Good morning, Singapore. Welcome to The Big Show and TheBigShow.tv. TheBigShow.tv, of course, is our Facebook page. It's Glenn, Angel, FD, Shaun, and every Tuesday we have from the therapy room, Dr. Geraldine Tan. Good morning.
Good morning, Dr. Geraldine. What was that? Was that jazz hands or something?
Spirit fingers. It must match his energy level. So I was like, every Tuesday, all of you are full of energy. I just have to match that level.
Well, we've been awake since 4 o'clock, so we've had time to build this up.
Lots of time to warm up, Jerry. Lots of time to warm up. So, Jerry, this morning I just want to kick things off by asking you this question, okay? Because of Naomi Osaka, who is withdrawn from the French Open. And of course, the reason for this is because she was fined $15,000 for not attending a press conference. Last week, she already said, when she gets to Roland Garros, she's not going to take part in, interviews and press conferences and all that. And she stayed true to her word. And of course, she got into a lot of trouble. The reason for this is because she says she has mental illness.
Mental issues, yeah. Mental health issues, yeah.
Yeah. So, do you think, I'm not saying that she doesn't have mental issues, but are people these days playing the mental health card?
A little too much.
In your opinion, yeah.
I think they are aware and they can put a label to it, and it helps. Because let's say you're sneezing all the time, but you don't know why you're sneezing all the time, and suddenly somebody tells you, oh, this is part of flu, and you go, oh, okay, I now know what it is. So now you hear that more often because people can put the label onto it already. Yeah, they can name it rather than to go, I don't know what's wrong with me, I just can't pull myself together.
But is this going to be a problem? I mean, going forward, because I feel like the whole Harry and Meghan interview has started
snowballing.
Yeah, I mean, any one of us, right, can play the mental card as well. Let's say I wake up this morning, I don't feel too good, I feel a little depressed for whatever reason, You're
not mentally sound.
Yeah, I don't feel mentally sound this morning, and so I call my boss and go like, I'm not coming in. Boss asks why. I go like, well, mentally I'm a little unstable this morning. If everybody does that, if all the tennis players at the French Open, they start citing, mental health issues, and I can't do an interview, I can't do a press conference, I can't make an appearance today, then we have an issue, right? We have a problem.
Yeah, but Jerry is so right. It's got a label. Before it was just like, oh, I'm not feeling so great. You're feeling a little bit down, but you don't actually say, I'm mentally not feeling balanced. If your elbow hurts now, it's no longer my elbow hurts. It's like tennis elbow. So I've got tennis elbow or whatever it is. If you put a label on something, it becomes real.
That's true. But Jerry, when it comes to this, I don't think your average professional is going to do what Glenn says, and just jump on this mental issue platform. I think that's going to they realize that that's not something you do. I think they take it more seriously than that.
No, okay. First of all, if it is a disorder, it has to be diagnosed. So you can't just slap yourself with it.
Yeah.
Okay.
Right.
You can't just tell yourself, oh, I've got depression, and tell the whole wide world you've got depression when no one diagnosed you. And so the symptoms have to be pervasive. It has to be prolonged before it can be diagnosed.
That is a good point.
Okay, so Naomi Osaka, was she diagnosed with?
That's the thing, we don't know.
Oh,
We don't
right.
know.
Okay.
So if we find out that she has a history, then
We keep
she's
quiet.
justified.
Okay. All
Right? Then she'll be justified. Correct, Jerry? If she has a history of mental illness, she's been seeing a therapist, and then she'll be justified.
Yeah.
But if she hasn't, and she's only now saying, I'm sorry, I can't do the press conferences, I will not do press conferences because I have mental health issues,
But seeing a therapist doesn't mean you have mental health issues.
But at least you have a history.
Is that
it's
right?
happened before, right?
Jerry?
So you can see a psychologist for well-being enhancement. You can go to a coach. It doesn't mean that you have a diagnosis. So if you're looking for a diagnosis, then it's something very different.
So someone like Naomi would be going to who? A psychologist or a sports psychologist?
A psychiatrist,
psychiatrist.
a clinical.
Yeah, which would it be?
So
Psychiatrist.
confusing, right?
Yeah.
Okay. So the sports psychologists primarily help them to sharpen their skills, to focus, to get over their own obstacle. Let's say they can't do certain strokes, and it is because of certain bad habits, certain experiences. Now the sports psychologist will help them with that. The clinical psychologist helps with the clinical disorders. So if you have a clinical diagnosis, you go to the clinical psychologist, and the psychiatrist would provide medication. Those are the medical doctors that provide medication to help balance the chemicals.
Look at us sitting in Singapore diagnosing Naomi Osaka's
Yeah.
problem, right?
But I just want to say that I'm with Naomi Osaka, and I feel like she's done the right thing because this is the right thing to say.
Yes.
Because
You're
if I
being
say
PC.
anything else, I'm going to be in trouble.
Yeah.
So I'm with Naomi Osaka.
Little heart. All right.
Withdraw anytime you want. I'm with you. I'm with the mental health patient.
All right, Dr. Jerry, we're picking off from where we left off last week with building
Yes.
resilience in our children. So
Yes.
we're going to talk more about that on thebigshow.tv.
Let me talk.
So, Jerry, last week we talked about what is resilience, and we talked about the 7 C's: competence,
Yep.
confidence, connection, character, contribution, coping, and control.
Yes, we did. So I deliberately gave all of you so you don't have to scribble down.
I still have it in my notebook.
come
I still
on.
have it. Yeah.
Jerry, just to let you know, it's all up here in my
Yeah,
mind.
right.
I didn't need to.
No,
He memorized
It's
it.
all there. It's all there. I'm a good student that way.
Angel actually takes notes.
Yes.
Angel takes notes throughout the show.
Everything.
Everything.
I'm
She's
running out
amazing.
of notebook space.
Yeah.
Okay. All right. So,
Same people. Let's try the
Who
tree.
uses notebooks?
That's why.
I do.
Well, actually, yeah.
Oops.
My wife does it as well. I just asked her the other day. I said,
Yeah.
"Who uses these notebooks anymore?" I do. Okay.
Yeah.
Maybe she needs a new one.
she needs a new one.
Don't step on our toes, man. We are the notebook. We are the pen and paper girls.
Yep, absolutely.
Okay, so where do we pick up
Anyways.
from today?
Okay. So, what quiz time? What is resilience? You should have it in your notes.
I don't know we're going to get tested.
I have the answer. It's the ability to stand when you fall.
She's the only one with the answer.
Glenn. Because I know Glenn says it's in here. Glenn,
They're gonna.
please help us to understand
What is resilience?
It's the ability to never be defeated.
It's the ability to handle the everyday things that life throws at you.
Don't guess live, D.
No, that's how I interpret it.
Okay. Shaun.
The ability to stay calm when everything around you goes to whoosh.
Okay. Yeah, so we all have different definitions. That's fine. Okay, so when things around you crumble and you fall and you can stand up again. You're not like flat out and just like in pieces. So that's resilience, the ability to do that. And then we broke it down into 7 C's. So we were taken through the 7 C's by FD, and now we're going to try and see if we can put it into some areas, because FD was very excited about parenting and resilience last week.
Yeah.
Yeah, so I've got 4 different areas. I think I spoke about the 4 parenting styles the last time.
Yeah.
It was quite
Was
some
it?
time ago, I think.
Yes.
Angel was on already.
Yes.
Wow, that long ago, huh?
Angel will always just say yes only lah. She action only. She
sure.
don't know. Just tell us what you have in mind.
Okay. Authoritarian, authoritative, permissive, and uninvolved. So those that are uninvolved would not listen to our radio show today. It is true. It is true. Those that are not involved would not be bothered about this topic at all. So those are. So I'm going to do a little quiz, and we're going to try and apply it. Okay.
Okay.
So let's go with uninvolved because it's the easiest, and you're going to try and see whether what do you give, or what is given, or what is taken away from the child when a parent is uninvolved.
Okay.
That means the parent is very neglectful, they can't be bothered. Let me give you a very extreme case by an insider in the ministry. So one of this case, this poor little child, I think I spoke about it before, two siblings, they were found. So the officers actually went to the house, and they were found in the toilet, fecal matter everywhere and on them, and one child was dead.
Oh no. How old were these kids?
Very young. So the one that passed away was barely a toddler.
Oh dear.
Yes, yeah. So neglectful, uninvolved.
That's very extreme uninvolvement.
So had to give you the most extreme, right? So what is given to the child and what is taken away from the child. So look at your 7 C's and see what is taken away and what is given to the child.
Connection is taken away.
Connection is taken away because the children were cut off from all the different human resources, and they perceive themselves as being very alone in that cocoon. That's true.
Confidence is taken away.
Confidence. How is confidence taken away?
Well, I guess the kids are too young, but they weren't able to stand up for themselves or speak up for themselves in that sense.
They don't know what they have. They don't know their abilities. They couldn't figure out what they can or cannot do. That's
So they
true.
have no control.
And they have no control because they were locked up in the room.
Yeah.
Yes.
Yeah, by incompetent parents.
I realized that Glenn was quite triggered by the story.
Oh, no. Poor thing.
Could it be that the parents were too over controlling? I mean, to be able to get their kids to that point? Is that possible?
An over-controlling parent would still give the children basic needs.
Yeah.
So to ensure the children are clean, they are well fed. Yeah.
I would have said that the parents had completely lost control and didn't know what to do. And they just locked these children away.
They just
Like
gave up,
animals.
yeah.
Like animals.
People like that shouldn't be having children.
Exactly.
They shouldn't be having
We
children.
shall not judge. We don't know
Yeah,
what
yeah,
happened.
we
I
don't
hope they're
know.
in jail, those parents, right now.
I have no idea.
I have
Oh,
no
really?
empathy.
Okay.
I know people are going like, hey Glenn, you should have empathy. Nope, I have no empathy for those parents. Sorry.
I'm
I
gonna.
have very little. I know don't judge because there's
We go back
always
on
a
air first.
backstory.
Stand by. We have Dr. Geraldine Tan from the therapy room, and today we continue talking about resilience and the 7 C's. That's the letter C, by the way. 7
this
C's.
is not the oceans.
Yeah.
Yeah. So the 7 C's of resilience: competence, confidence, connection, character, contribution, coping, and control.
Yes, that's
And-
right.
Jerry, can special
Yes.
needs children develop resilience?
Definitely. I mean, if we just go by this framework, right? Of course they can, if they know what if they can experience different things, they're exposed to different things, they're affirmed for it. That's already competence. Okay, they start to gain confidence because they know what they can and cannot do. They know that they are not alone, so you connect them with different people, all the different resources that is out there. They know what is right and wrong, so that's character. Okay, they can contribute. That means they not only receive help from other people, but they also can do something for the community, which many of these social enterprises are helping them do, right? And they know how to cope healthily. So that's what the behavioral therapists, OT, psychologists are helping them to cope in a healthy manner. And they have the ability to make some decisions. So that's control. So that's all 7 for you.
Oh, brilliant.
Nicely
Brilliant.
put down.
Jerry, we've got a question from Joel that I want to deal with. Well, not a statement, and I've got a question to this. Joel says resilience is the ability to persevere despite encountering obstacles. What's the connection between resilience and perseverance?
That's grit, right? So grit, we persevere through. We don't allow ourselves to kind of break down and just pause, and you cannot go through difficulties, go through challenges, right? I think how the story of the pearl. Do you know? I love pearls, by the way. I always wear my pearls. Yeah. The story of the pearl. So in how the pearl is made is it has to have an irritation. It has to have an annoyance. But the annoyance doesn't break the whole shell down and doesn't break that whole thing down. Instead, you layer it with a lot of love, a lot of care, and it becomes something very beautiful.
Right. From a tiny grain of sand.
From something tiny. It can be a sand, it can be any irritation at all. Usually sand, but it can be anything. And it just goes on and on and on. So that's perseverance. And that's not letting that grain of sand get you down.
Okay.
That's
So
an
there's the
interesting
difference.
analogy. Yeah.
And look at those beautiful pearls on your ears.
I need to introduce you to Carrie Kay. She's got some beautiful pearls that you need to see.
Yes,
Yes.
please.
Okay, we're talking to Dr. Geraldine Tan from the therapy room about resilience today.
Okay, so Jerry, you were talking about parenting, and you said the 4 different types of parenting styles:
Yes.
authoritarian, authoritative, permissive, and uninvolved. You spoke about the uninvolved parent.
Yes.
What's your next parenting style that you're going to zoom in on?
Authoritarian. So
Ooh.
authoritarian is the military style, everything in order. The overbearing parent, the tiger moms, and tiger dads, so they coined it themselves, but under the umbrella, it is authoritarian. So again, who is going to take up what is given to the child, what is taken away from the child in authoritarian parenting?
I think in authoritarian parenting, again, control is
Control
taken away
taken
from
away.
the child.
Yeah.
Yes.
Yeah,
Yes.
absolutely. The child has no control in that situation.
Which should
at
be
all.
the way, because,
No.
you're talking about a child. The parent should be in control.
But but a child needs a certain degree of control as well.
No, that's what I'm saying.
A child needs control.
A child needs
No,
control.
not that you're talking about. A child needs to be controlled.
Yeah.
I'm saying a child needs control
Of their own.
of their own.
Yeah, but the child won't know how to control if they're not taught what control is. What? You let a
So-
child go free, you'll be in trouble.
What do you think, Jerry?
You love the child less if you have no control over the child.
You can never love your
All
child less.
parents love obedient children. Okay, I'm telling you this.
And
right?
they don't love disobedient children?
Disobedient children, they love less.
Oh, that is crazy.
This is coming from a person who is not a parent.
No, exactly.
it's
But
very
I'm a
different.
parent to a dog, right? I'm a parent to a Jack Russell Terrier, right? And when he's disobedient, I don't love him as much. But when he's obedient, I love him a lot. So, it's very similar. You guys might laugh at me because you guys are a certain type of parent, okay? But
Careful now.
we are talking about authoritarian parents. And I'm saying that the character of an authoritarian parent is exactly that. If they can't control their kid, if their kid is disobedient, they will love their kid less.
Jerry.
You guys are not authoritarian.
Jerry, comments, please.
No.
I really want to know.
Oh dear, I don't think you're authoritarian, Glenn. You will never be an
I
authoritarian.
will be a tiger dad.
No.
You'll be a marshmallow.
I think he actually would.
Yeah,
I think he
that's
actually would. Yeah.
I think you don't love your little Jack Russell less when he's disobedient, but your emotions are more negative. So, and you, that point, and you're alerted to put more boundaries in for your little one, your little dog, right?
Mm-hmm.
And it's not that you love him less; it's because you love him a lot.
That's
love him
why you feel that
equally.
way.
Yeah, no, I
So
definitely
that's
love
why
him a
you
lot.
want to do that for your little Jack Russell. But authoritarian is different. Authoritarian is very overbearing, controlling each and every movement until the child feels so choked, stifled, and stuck. And most of the time, when they grow up, they have very bad coping strategies. So your drinking, your substance abuse, they tend to come from parents. Sometimes parents who are very overbearing, and these children try and escape it.
And you're also taking away their confidence at the same time, right?
So they don't know what they can or cannot do. That is true. So that's why they don't know what to be confident in. So they don't get to try anything. So then they don't feel competent in
But
anything.
some kids are so irritating these days. You just want to slap them. They're like 7 years old, thinking that they're 70 years old
No, that
already.
is true. Yeah,
No,
some
there
children
are- there are kids
they have no
like
respect.
No, there are kids like that, but then that boils down to the parent and how you deal with it. You
Yeah.
don't have to be authoritarian
No, but you
to
see,
deal with that.
You
see,
can
the-
be authoritative.
Yes.
You see,
yeah.
I hate it when kids are very respectful of their parents,
But not of others.
but not of other people. They're just rude to everybody else.
That's bad parenting.
That's
yeah,
horrible
that's
parenting.
parenting. That's not the child.
And we
Yeah.
have friends like that.
That's parenting.
Would you
That's
like
not
to
the
name them
child.
now?
Am I right to say that that's parenting and not the child, Jerry?
It's a mix of many different things. I don't think we can only blame the parent. I think parents are having a very tough time.
No, but
and if you
I
keep
mean,
pointing.
but Glenn
fingers-
said if they're respectful to the parents but not respectful to their friends, then
Yeah.
that is part of the
Yeah.
parenting style, isn't it? I mean,
Parents should always teach their kids to be respectful of other people.
everyone. Yeah,
we were
I
taught
agree.
that when
That I agree.
when we were young.
we were never allowed to be rude to
Exactly.
anyone.
Okay, so something went wrong with the morals, right? Or the character. So character is also another area. So can it be part of parenting? Could it be part of the whole environment? Sometimes you ask the teens or the children, why do they do that? They say, well, so one of the teens I saw last week, he said that I can't help it. It's because I was bullied and I learned how to behave that way with people. And so because when I started to behave that way and become very caught with them, they stopped bullying me. So now I don't know how to change. It's food for thought, because it's not just one thing that causes a certain behavior. Yeah. So just a little bit more of to dip into that. So I have on my notes personality and character. So the character of the person can be built over time.
Yeah.
The personality is inborn. So if you're telling me that the child has some ability to be respectful and polite, and when they go outside they are not, so is it a character or is it a personality? Which one is the one that we are looking at? I'm not sure which one was nurtured and which one was nature.
Okay.
Interesting.
Okay, so that's you got uninvolved, you got authoritarian. What about
Yep.
authoritative, if that's your next one?
Authoritative would be the last one,
Okay.
because that's the best balance that we want to achieve. So we go with permissive.
Okay.
The everything also can sort of parent.
My child can do no wrong.
Yes,
Yeah.
they can do anything. Now, this is interesting because a lot of parents confuse authoritative and permissive. In the past, they confused authoritarian with authoritative. Now they're confusing authoritative with permissive.
How do they do that?
Yeah.
Because they say, oh, I talk to my child, I give them a lot of leeway, I give them a lot of space to grow, so I'm being authoritative. But where's the line between permissive and authoritative? So I will then check again. So permissive parenting, that everything also can. What do you think is being taken away or given to the child? I think Glenn actually spoke about it earlier.
So I'm not saying anything already because I feel like maybe I was a little bit too aggressive. I think I better keep quiet for a while.
Control.
Because I think about spoiled kids, right? And I get really angry. Because as I said, right? I mean, parents should definitely teach their kids how to be respectful.
I agree. I think by being permissive, you're taking away the ability for the child to build character.
Okay, you tell us the answer.
Okay, hold on. We're going to
We'll
go for a
there.
traffic
We'll go.
break. Good morning and welcome to the big show with Dr. Geraldine Tan from the therapy room.
Good morning.
We're talking about some of the things that are taken away from a child when the parents are permissive. I think what's taken away from the child is it's control, because I can do anything and I can get away with it. Therefore, I don't need control. Whatever I do is okay.
I was going to say that giving the child too much control at too young an age. probably.
Yeah, to the point where parents actually lose control.
Yes.
Yes.
They have
Exactly.
no control over their
Yes.
kids. I mean, we've seen embarrassing situations,
Yes.
in restaurants, shopping malls, and all that.
Yes.
Where you just want to shout out, "Hey, useless parents!"
Yes, but I've also seen a lot of not a lot, a few friends that have autistic children where they cannot control their behavior in public.
Yeah.
And I used to think kids were just naughty and annoying, and couldn't be controlled. But sometimes I've realized that these kids may not have control over their own behavior.
Like if the kid is autistic, okay, fine.
But
I'm not
you don't
talking
know.
about.
But you don't
never
know.
know.
Sometimes
Yeah.
you don't know.
But the majority are just brats.
Yeah,
that much I can say. The minority are autistic.
Or-
they have
or have-
attention deficit disorder, ADD or whatever,
ADHD,
right?
yeah.
ADHD, something like that.
Yeah.
But the majority of them are just brats.
I have to agree with that as well, actually.
I was so taken by the autistic part, and then after that, just brats. I was like, oh.
Glenn just shot it all down.
Maybe I'm older. Maybe my parenting style is different. But I personally feel that brats are bred.
Yes.
Yes,
Brats
absolutely.
are not born. So again, I am
Yeah.
sorry. I'm so sorry. I throw it back to the parent.
Yeah. Exactly.
Boundaries
Parents who are
also,
watching right now, I mean, is your kid a brat? I mean, ask yourself. Is your kid a brat?
My child can
you
do no wrong.
Do you have any control of your child whatsoever? You don't. Oh, a few of them just tuned out.
We just saw them drop off.
Dum, 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 dum.
Oh no!
Because they can't
Okay.
face the truth.
One of the important thing is to look at the character. The morals, the right and the wrong, and to teach the children that what is right and what is wrong. So many of the autistic little kids are so cute. Sometimes they come and take your things, or they are just about to do that. Then they say, "Cannot take right, cannot take right."
Yeah.
They know that because we have taught them, but they are naturally curious. They are children, but we know they have been taught because they tell us. They are so honest as to tell us, right? Yeah, so it is important for the parent to teach them the rights and the wrong. And sometimes permissive parents do not they tell them, but do not follow through with the actions. And therefore, the children have no imprinting of where the boundary lines are. So that makes it very difficult for the children to comprehend what is the boundary line when they go out into society. So they would consistently push boundaries with everyone that they meet. So we perceive them as brats.
Okay.
We have someone texted in that said, "My child is a brat. She's a manipulative monster going through the terrible 2 stage."
No, but all 2-year-olds are manipulative.
Yeah. 2-year-olds are still okay. You know,
they can still get away with
Yeah,
a
yeah,
lot.
yeah.
They can still get away.
I think if I'm a parent, I'll just cut them like that slack. You know, I mean, till they're about maybe 5. You know, but earlier on, it's
But
they're
I
still kids.
disagree. Actually, I think kids should be taught from very young because a lot of parents use the excuse, "Oh, they're still very small."
But not at 2, though.
No,
So
yes,
you can train them already at that
absolutely.
too.
You can
Okay.
train them from from birth because. Sorry, Sean.
No.
Oh, okay. Because a lot of parents will say, "Oh, no, they're still small. They don't
Yeah.
know what they're doing and all that." But these kids know. I mean, for the
know.
very fact that this person who texted in said manipulative.
Wow.
You know, at 2 years old means this parent knows exactly that the child knows exactly what they want,
Yeah.
and that's how they're manipulating the parent.
Yeah.
So
I
these kids
think
know.
I think this parent is just tired and exhausted.
And I think,
Tell this
Sounds
parent to take a break.
but I think this parent is going to be a fantastic parent because
Yes.
this parent is aware.
Yes.
You know,
Yeah.
and so she's not going to
True
let
that.
this child, get away with it too much.
Yeah.
You know, as she grows older, she'll be taught the right things.
Yes.
Respect by
By
this
this parent. Well done, whoever this parent is.
One can say she saw the sign.
Nicely done. Nicely
Well
done.
done, Sean.
Nicely done. Nicely
Well done, Sean. That's because Ace of Base is next up on the big show.
Jerry, tell me if I'm right. Whether we are talking about authoritarian, authoritative, permissive, or uninvolved, children are sponges.
Yes.
They learn by watching their parents. So you
Correct.
need to practice what you preach.
Yep.
Correct?
True. Exactly. So a lot of times parents forget that the children learn the best by looking at us and mimicking us.
And the worst.
Yeah. And the worst,
Yeah. That's how they learn to be manipulative, right?
Yeah, no, it is true. It is true. They have to pick it up from somewhere as well. Yeah.
so if we look at today we're not only talking about parenting but also about resilience. If we look at the 7 C's and apply it onto ourselves, do we have these within ourselves? And I particularly want to highlight one thing which I thought was very interesting: contribution.
Yeah. What do you mean by that?
A lot of people think that, I help other people and I will take on the weight of the world, playing the superhero, right? But in contribution here, in terms of resilience, is to learn to contribute to the people around you, to society, so that you learn how to receive the help also. So in resilience, you not only need to give, but you need to
take, yeah.
receive. Because if you don't receive, you will crumble. Imagine resources given to you and you have no ability to take it, which is what many people think that, I'm a giver, but they break down themselves at some point or other. So we want to teach each person to be able to give and to be able to receive the help.
That is true, because I've heard that many times where people have gone, I've spent my whole life giving and look what I'm left with. Isn't that the same thing? Isn't that what we're talking about?
It's similar because if they feel so broken, they feel so abandoned. So another one is connection, right? So they feel alone. So how can you then say that I can work through more things and stand up in more situations if I feel alone, I feel abandoned, I feel like an imposter? I think we spoke about the imposter syndrome. I feel like an imposter. I don't feel confident. So you start to shoot down all these. You become a very broken person.
So isn't contribution also the act of reciprocation?
To give back?
To give and to receive as well. Because, I mean, if you give something, you receive something. Or if you receive something, you also give back.
Yeah.
to reciprocate can sometimes connote a lot of responsibility. Some people find it a chore. Some people find that it is a very heavy burden. Like at some point,
Owing someone.
yeah, they will say, please don't give me any more. Yeah, so
Right.
this is slightly different.
Okay.
This is being able to help and to receive help
Okay.
when
Okay.
needed. Yeah.
Okay. So the act of giving will teach you the art of receiving as well.
Yes, that's what we want to cultivate.
Okay. Okay.
Right. There are many people who receive. They just receive,
yeah,
but
yeah.
they don't give.
That's true. That's the other
You know
side
what
of
I
the
mean?
coin.
Yeah.
That's the other side of the coin.
So yeah, I mean, there needs to be a balance.
So how do we help boost our kids then, Jerry, when it comes to resilience?
To the different areas. So let's go through it again. So competence to give them as much exposure as possible. So the authoritative parent gives the platform for the children to explore within a safe boundary. The confidence to know what they can and cannot do, so they affirm their children, to let their children know that they are not alone, to resource them. Okay, to hi Geraldine.
Morning, Jerry.
To teach them the rights and the wrong, so the moral compass. Yeah. Again, the contribution part, to be a resource and to receive resources. No point telling them, all the to just do, but don't know how to receive the resources around them. Coping strategies, to exercise, to eat healthily, so different coping strategies, and to learn how to make decisions and bear the consequences of their decisions.
Yeah, that's important.
That is so important.
That's very important.
It's like there are consequences
To everything.
Yeah.
To everything.
I taught my kids that when they were very young.
Yeah.
Yeah.
Yep.
Very young.
Kids should be taught that. Employees should be taught that as well.
for
Yes,
sure.
yes.
For
Bosses
sure.
should be taught that as well.
Basically, if you're a child, you're going to grow up to be a great everything, right? If you learn all that as well, employee, employer, and a friend and parent.
There are consequences. Yeah.
Yeah.
Okay.
Yep. So these few areas, so to bear the consequence, because permissive parenting forget to teach them to bear the consequence. When the kid does something wrong,
It's okay.
the parent, no, it's not okay. It's not okay, but the parent bears
the consequence, yeah.
consequences. So many parents of drug addicts, they bear the consequence. They say, no, I was the one that bought the drugs for him,
Or it's
I
my
was the
fault,
one.
right? Yeah.
Yes. So then the child never learns.
Totally agree.
That's spoiling your kids.
Yeah.
That's spoiling them.
Permissive, yeah.
And how are you, Julian? How I mean, last week we were talking about your how old is your kid again?
My elder one is 2.5.
Two
And
and a
does she love you more this week?
No, not at all.
Still goes to mommy.
No, but, Julian, what kind of parent are you? Authoritarian, authoritative, permissive, or uninvolved?
I am very involved, but I don't know what I am. Honestly, I'm very involved. All I know is I don't spoil my kids at all because of that, and because I don't spoil my kids at all, I realize that I am very strict, I'm very firm, I can be very harsh. And I think that's why my daughter rebels a little bit.
Yeah, probably.
But you are very loving to your kids as well, right?
Yeah, I mean, definitely. I do my best. I still want to... Yeah, by my
You think
standards
you're
at
loving.
least.
You do your
Yeah,
best
yeah,
and you hope for the best.
Yeah. I still make the effort. Honestly, I still bring them to the playground. I still shower them.
And they still laugh with you and hug
they still
you
laugh
every
with
now and then.
me,
So
yeah,
you're
you know.
fine.
But the laugh is like a ha ha ha.
Yeah, I get that. I get that a little bit. They're more like the. But there are times where she'll just come to me and say, I don't want Papa. I just feel, yeah.
Okay,
She'll
we're going back
outgrow
on
that.
air. We're going
She'll-
back on air, and then we'll come back and we'll close with you, okay, Jerry? Good morning, Singapore. Welcome to The Big Show and TheBigShow.tv. Our guest for this morning is Dr. Geraldine Tan from the therapy room. We've been talking about resilience. Very soon we'll be joined, Julian is already here. He is the editor of SG Karma, and we'll be talking about feng shui today. The color of your car, does it matter?
Okay, I've been doing a little bit of research, and you drive a grey car, right, Glenn?
Yes.
Yeah,
I
the
don't think it's
description-
called grey.
Selenite grey.
There you
Yeah,
go.
what it's supposed to say about the driver and what you are, completely different.
Okay. Back to Jerry first. Jerry, okay. I want to ask you because, I just mentioned what we'll be talking about with Julian today. So,
Yes.
what color is your car?
Blue.
Blue, huh? What
Oh.
blue though? Royal blue, dark blue, scum blue?
No.
Because scum blue
I
is
have
the
no
color
idea.
Man City
It's
wears.
blue.
No.
Cars are functional.
Or just just blue.
I think it. According to the research I've done, it's partly correct, but not totally.
Okay.
Okay, all right.
But back to Jerry. So, Jerry, today, topic of resilience. In conclusion,
Yep. So I was thinking, which one should I say? Okay. So I think I still want to emphasize on communication. So that whole communication piece, a last C to tie up everything to help build the children. So I'm gonna say this: distance doesn't separate people. Silence does.
So true.
so communicate a little bit more. Connect. In that area.
Sometimes, connect,
Because
yeah.
sometimes when I'm angry, I just give my daughter the silent treatment.
But your silence speaks volumes. You see, it's
Yeah.
different.
Oh, okay.
Yeah.
Oh, okay.
I think
Oh,
it's
that's
just
all.
us, Julian. Us guys are like that, no? Sometimes I just feel these days, maybe I'm growing old or what. But after a while, I just don't feel like saying anything, no?
Yeah, exactly.
Yeah, it's like-
exactly. I just.
Right?
Oh, dear.
man.
That's a topic for another day, isn't it, Jerry?
I these boys.
These boys, they're beyond therapy.
Okay, thank you very much, Jerry.
I'll see all of you next week. Have a good session.
You too. You
Bye,
too.
Jerry.
Bye bye.